If you've been feeling that strange burning, tingling, or numb sensation in your hands or feet, the kind that feels almost electric or impossible to describe, I want you to pause for a moment and truly listen. This is not something random, and it is not something you should simply accept as part of getting older. In clinical practice, I see this pattern far too often, and one thing is always clear: your body is trying to get your attention. Many people assume these sensations are harmless, just another sign of aging, but what's actually happening is much deeper. Your nervous system is sending a warning signal. It's not subtle, it's persistent, uncomfortable, and sometimes even frightening. That tingling, that burning, that numbness, those are not meaningless sensations, they are messages. And when those messages are ignored long enough, they don't just fade away, they can disappear entirely. And that's where the real danger begins. Because when sensation starts to fade, function follows. It becomes harder to feel the ground beneath your feet, harder to judge pressure with your hands, harder to trust your own balance. Everyday actions, standing up, walking across a room, holding a cup, can slowly become uncertain. And over time, that uncertainty can turn into loss of independence. Falls become more likely, coordination becomes unreliable, and confidence in your own body begins to fade. But here's the part many people are never told: this process is not always inevitable. In many cases, it's driven by something very specific. Your nerves are not getting what they need to maintain themselves. The protective layer around them begins to weaken, and the signals they carry start to distort. From a biological perspective, your nerves rely on precise nutrients to function and repair. Without those building blocks, they begin to deteriorate. One compound that has been studied for its role in supporting nerve health is a specialized fat-soluble form of vitamin B1 known as benfotiamine. Unlike standard forms of vitamin B1, this version is more easily absorbed and can reach nerve tissue more effectively. However, this is where many people unknowingly make mistakes. Simply taking a supplement is not always enough. The body's ability to absorb and use certain nutrients depends heavily on context, how they are taken, what they are combined with, and even what other substances are present at the same time. For example, fat-soluble compounds require dietary fats for proper absorption, and certain imbalances, including inappropriate intake of vitamin B6, can actually interfere with nerve function rather than support it. So what you're experiencing is not just a symptom, it's a signal tied to real biological processes. And understanding that changes everything. Let me bring this into your daily life, because this is where it becomes real. Think about your mornings. Do you get out of bed with the same confidence you once had? Or do you pause for a second, making sure your feet are stable before you stand? That hesitation, even if it's subtle, matters. It reflects how your brain and body are communicating. Or consider simple tasks, like turning on the faucet. Does the temperature feel consistent, or does it sometimes feel exaggerated? Too hot, too cold, almost confusing? That's not clumsiness. That's altered sensory feedback. Even something as routine as buttoning a shirt or holding your keys can change. You may find yourself dropping things more often, not because you're weak, but because your fingers aren't receiving precise information about pressure anymore. The connection between intention and movement becomes slightly off, and for many people, the most difficult time is at night. You lie down, exhausted, ready to rest, and suddenly your legs feel restless, your feet begin to burn or tingle, and the simple touch of a blanket becomes uncomfortable. Sleep, which should restore you, becomes another challenge. If any of this sounds familiar, it's important to understand something clearly. This is not just aging. While aging can influence the body, what you're describing aligns with patterns we recognize in conditions like peripheral neuropathy. And when it's dismissed as something normal, the underlying cause is left unaddressed. Unfortunately, many people have had the experience of seeking help, only to be told that nothing serious is wrong. They're given medications designed to dull the sensation rather than restore function. And while those medications may reduce discomfort, they often do not address why the nerves are struggling in the first place. This is where perspective matters. Your body is not failing randomly. It is responding to imbalances, deficiencies, and stressors that can often be identified and, in many cases, supported. So instead of ignoring these signals or masking them, the goal should be to understand them. To recognize that your nervous system is adaptive, but it needs the right conditions to repair and function properly, and that begins with awareness. Now let's slow this down and truly understand what is happening inside your body, because once you can visualize the structure, everything starts to make sense. Imagine the wiring system inside a house. Hidden behind the walls are long electrical cables that carry power from the main breaker box to every room. Each cable has two essential parts: a conductive core that carries electricity and a protective outer layer that keeps that current contained and stable. Without that outer layer, the system becomes dangerous. Electricity leaks, sparks, and eventually fails. Your nervous system follows that same exact design. The brain and spinal cord act as the central control unit, and from there, millions of tiny nerve pathways extend throughout your body. These pathways carry signals, movement, sensation, balance, from your brain to your limbs and back again. The nerve fiber itself is like the conductive wire, and the protective coating around it is known as the myelin sheath. When that protective layer is intact, communication is fast, precise, and reliable. Years ago, your signals traveled effortlessly. Your body reacted instantly to changes in your environment. Balance felt natural. Movement felt automatic. But over time, that protective coating can begin to wear down. And when it does, the signals traveling through your nerves no longer move cleanly. They begin to leak, misfire, or slow down. That's when the strange sensations begin. The tingling, the burning, the pins and needles that seem to appear without reason. Those sensations are not random. They are the result of disrupted signaling. It's as if exposed wiring is sparking inside the system, and if that process continues long enough, something even more concerning can happen. The signal can stop altogether. That's when numbness appears. Not discomfort, but absence. A lack of sensation where there should be feedback. This is why some people begin to feel disconnected from their own feet or hands. The brain is sending signals, but the pathway is no longer intact enough to deliver them properly. And that disconnect can affect balance, coordination, and safety in very real ways. Naturally, when people begin to understand this, they ask an important question. If the body is designed this way, why does the system start to fail? One key factor involves a nutrient that plays a fundamental role in nerve function: vitamin B1, also known as thiamine. This vitamin is essential for maintaining the integrity of nerve cells and supporting the processes that help protect and repair them. Without adequate levels, the body struggles to maintain that protective structure. But here's where things become more complex. Getting nutrients into your body is not the same as your body actually using them. As we age, the digestive system changes. The stomach produces less acid, and that acid plays a critical role in breaking down food and releasing nutrients so they can be absorbed. What used to be an efficient system becomes less effective. Even if your diet looks healthy on paper, your body may not be extracting the same level of nutrients it once did, so it's possible to eat well and still come up short. And there's another layer to this that often goes unnoticed. Certain commonly used medications can influence how nutrients are processed in the body. For example, some treatments used for managing blood pressure, particularly those that increase fluid excretion, can also increase the loss of water-soluble nutrients. One class of these medications is known as diuretics. Their purpose is to help regulate fluid balance, but because some nutrients travel in the bloodstream dissolved in water, they can be affected as well. This doesn't mean the medication is bad or should be stopped. It means the system is more interconnected than it seems. Supporting one area of the body can sometimes influence another, and awareness of that interaction is important. When you put these pieces together, reduced absorption, increased loss, and higher demand, the picture becomes clearer. The body may not be getting or maintaining the levels it needs to properly support nerve health. And when the nervous system doesn't have the resources it requires, the signals begin to change. What you feel on the surface, burning, tingling, numbness, is simply the visible part of a deeper process happening underneath. Now, before we go any further, I want to make something absolutely clear. This is not about fear, and it is not about abandoning treatments that are keeping you stable. If you are taking medications for blood pressure, for blood sugar, or for any chronic condition, those prescriptions exist for a reason. Stopping them abruptly is not the solution. What we are talking about here is something different. It's about understanding the full picture. Because while these medications support vital functions like your heart and metabolism, they can also influence how your body handles certain nutrients. And if those nutrients are not replaced or supported properly, other systems, like your nervous system, can begin to struggle. For example, medications such as metformin, commonly used to manage blood sugar, can affect how the body absorbs certain vitamins over time. Similarly, frequent use of antacids can reduce stomach acidity, which plays a key role in breaking down food and releasing nutrients. And as we discussed earlier, some fluid-regulating medications can increase the loss of water-soluble nutrients. None of this means those treatments are harmful or should be avoided. It simply means the body is complex, and when one pathway is supported, another may need attention as well. Now, here's where many people reach a turning point. They begin to understand that nutrients like vitamin B1 are important, so they take action. They go to the pharmacy, choose a supplement, and start taking it consistently. And for a while, they feel hopeful. But then weeks pass, and nothing changes. That's when frustration sets in. It can feel like you did everything right, and still nothing improved. But in many cases, the issue is not effort. It's specificity. Not all forms of a nutrient behave the same way in the body. Standard forms of vitamin B1, such as thiamine hydrochloride or thiamine mononitrate, are water-soluble. They dissolve easily in the bloodstream, but that doesn't necessarily mean they reach the tissues where they are most needed. The nervous system, especially the protective structures around nerves, is rich in lipids, meaning it has a different kind of biological environment. And here's where the concept becomes important. For a compound to effectively interact with certain tissues, it often needs to be compatible with that environment. This is why a specialized form like benfotiamine has been studied in the context of nerve health. Because it is fat-soluble, it behaves differently. It is able to move through lipid-rich environments more efficiently, which may allow it to reach nerve tissues in a way that standard forms cannot. Think of it less as stronger and more as better matched to the environment it needs to work in. But even with that understanding, there is another critical piece that often gets overlooked. How something is taken can influence how well it works. Fat-soluble compounds, by their nature, require the presence of dietary fats to be properly absorbed. Without that context, even a well-designed compound may not be utilized effectively. This is why timing, combination, and consistency all matter. In clinical settings, what often separates people who experience improvement from those who do not is not just what they take, but how they integrate it into their daily routine. And this is where discipline becomes important, not extreme measures, but consistency, understanding that the body repairs gradually, not instantly. That support needs to be repeated, not occasional, because ultimately, your nervous system is not static. It is responsive. It adapts to the environment you create for it. And when that environment begins to shift, when the body finally receives what it has been missing, change becomes possible. Now let's bring everything together, because understanding the cause is only one part of the equation. The real difference, the point where people begin to reclaim control, comes from how they apply that knowledge in their daily routine. If your nervous system has been struggling for years, a minimal or occasional approach is not going to be enough to shift that trajectory. What we are talking about here is supporting a repair process in tissue that has been under stress for a long time, and that requires consistency, structure, and the right context. When people begin using targeted nutritional support like benfotiamine, one of the most important factors is not just the compound itself, but how it is integrated into the day. Small, inconsistent habits rarely produce meaningful change in biological systems that depend on repetition and availability of nutrients. Another key detail involves how fat-soluble compounds behave in the body. Unlike water-soluble vitamins, these require the presence of dietary fats to be properly absorbed. Without that context, even a well-formulated supplement may pass through the system without being fully utilized. This is why pairing intake with a balanced meal that includes healthy fats such as eggs, avocado, nuts, or dairy can make a meaningful difference in how the body processes and uses these nutrients. Timing also plays a role. B vitamins are closely linked to cellular energy processes. Taking them earlier in the day tends to align better with the body's natural rhythm, supporting daytime function rather than interfering with nighttime rest. Now, something that is rarely discussed but very important is expectations. The body does not repair overnight. Nerve tissue, in particular, is known for being slower to recover compared to other systems. So understanding the general pattern of adaptation can help you stay consistent without becoming discouraged. In the early phase, many people notice subtle changes rather than dramatic ones. Mental clarity may begin to improve. That heavy, sluggish feeling during the day can start to lift slightly. These are early signs that cellular processes are becoming more active. As time progresses, sensations may fluctuate. Some people report temporary increases in tingling or unusual feelings as the nervous system adapts. This can feel confusing, but in many cases, it reflects changes in how signals are being processed rather than simple decline. Over longer periods, weeks to months, the goal is gradual stabilization, less intensity and discomfort, more confidence in movement, better coordination in daily tasks, small improvements that begin to add up into meaningful changes in quality of life. It's also important to approach this responsibly. Anyone with complex medical conditions, including those under specialized care, should always discuss significant changes in supplementation with their healthcare provider. The same applies when combining multiple nutrients. Balance and compatibility matter. For example, forms of other B vitamins can vary in how they are processed by the body. Options like P5P, the active form of vitamin B6, or methylated forms of vitamin B12 are often discussed in the context of bioavailability, but individual needs can differ. This is why personalization is key. At the end of the day, this is not about chasing a quick fix. It's about creating the right internal environment, one that allows your body to do what it is naturally designed to do: adapt, repair, and respond. And that brings you to a choice. You can continue treating the symptoms as something random, something unavoidable, or you can begin to understand the signals your body is sending and respond to them with intention. Because when you align your daily habits with your biology, even in small, consistent ways, you give your system a chance to recover function, not just mask discomfort. And for many people, that shift is where everything begins to change.